Welcome everybody to another session of the Lyme Disease Resource Center's practitioner series. Tonight we have Kerry Lang, who's a licensed mental health counselor who has been with us before in the past in person. And we're really excited to have her back again post-COVID. And she's going to be telling us a little bit about her story and battle with Lyme disease, but also how she has taken that and become a very good counselor and the former mental health manager at the Dean Center for Tick-Borne Illness in Boston, and how she's doing today. And Kerry would like to be very casual, and once she's done with her story, we will open the floor to questions and sharing. So, Kerry, thank you so much for coming tonight.
Yeah, thank you so much for having me. I was sharing in some posts promoting this event today that I have such a special place in my heart for Lyme Disease Resource Center, especially, its roots in Northampton, because I actually lived there when I first got diagnosed with Lyme disease in 2010. And I think, if I'm not correct, Marie, you guys opened your doors, was it 2012 or?
2013. So we're celebrating our 10th anniversary.
I know, it's wild. I had already left Northampton by the time that Lyme Disease Resource Center opened, but I wish I had had something like this when I lived there. So I don't very often share my story, my journey with Lyme disease, but I did quite a bit of thinking about what might be helpful tonight. And I could throw a whole bunch of resources and research and data at you guys about mental health and Lyme and long COVID, yada yada. But I think what might be really helpful is sharing how I got here, and also what's guided my approach with patients today. And that's not the medical stuff. I could share every single medical treatment that I've tried, and I have tried a lot. And I will be sharing a little bit of that. But what I want the takeaways to be is really some of the lessons that I've learned, and some of the journeys and things that I've had to change about my own thinking. Some of the mind body medicine stuff that I've had to do. Finding meaning and purpose and all of it, which is really, I think, what I attribute my recovery to. And I know you guys are probably all thinking, is she better? Is she better? Because I know that's what we all want when we're sick, somebody to have this like story of being cured and sharing what that treatment is. I will say I am mostly better. I still have to take care of myself. So I am telling you that now so that you're not waiting for the next half hour, however long I speak for that answer. But yeah, so it's taken a while. Like I just said, I got sick initially in 2010. I was working as an elementary school teacher in West Springfield, moved out here for that job as a teacher. I taught third grade, and then my second year I taught fifth grade. And I was 26 at the time, or maybe 27. I can't recall the exact age, but I was, mid-20s. I should have had, unlimited energy. And I slowly started to notice that I really, really felt like I was like 90 years old. And I attributed that to all different kinds of things, I'm a teacher. I'm getting sick. I'm getting all these viruses, which I was getting nonstop sinus infections. I started forgetting things though. And you get, again, oh, it's ADHD. And then, I'd take my ADHD meds, and then I'd drink caffeine, and then I wouldn't sleep, and then I'd blame it on being tired. Kind of never really was in touch with my body enough to really know that something was seriously wrong with me, but chalking it up to all these other things. And got to a point where I started forgetting about meetings, started forgetting students' names, starting forgetting things that I really shouldn't be forgetting, and not being able to keep up with work. and feeling overwhelmed by very simple tasks like just laundry, which I'm still overwhelmed by. That hasn't changed. But I have a toddler now, that's why. And I ended up actually getting symptoms of what some of you may know as Morgellons disease. And that's something I really don't share a lot because it's very triggering and has been traumatizing to me, but also I just haven't really felt comfortable with it, I guess, until now. Morgellons disease is actually a sort of unique set of symptoms that come with Lyme disease, but they have discovered and kind of proven in recent years that it is just a unique presentation of Lyme in the skin. But I interpret it as there were bugs crawling all over me, stinging me all over. And I was in extreme duress, very, very close to having to be hospitalized due to the distress it was causing me. Morgellons disease presents as having bugs crawl over you, but that feeling, that sensation of crawling and stinging with also lesions, which I had. I was told they were spider bites by my doctors, which didn't go over well because in my brain that reinforced that might have been like, what was happening. But it also presents as having fibers actually come out of your skin, which sounds like it's some kind of science fiction movie. It felt like I was living in a real life horror movie at the time. And I'm sorry if this is disturbing for some of you to hear. That's another reason why I don't share it. Again, the fibers have now been proven to be collagen and keratin fibers, which they think the Borrelia bacteria produces in your skin and causes them to reproduce at a higher rate. Anyway, it looks like little salt and pepper flakes coming out of your skin at times, and sometimes little strange little tiny fibers that are black. And it's the weirdest disease ever to have. And I discovered early on that there were links to Morgellons disease and Lyme disease, thankfully. And I tested positive on a Western blot. So my saving grace is that I figured out the Lyme connection early on, and I tested positive because I was able to get treatment. Didn't last. It lasted about a month that I got better from antibiotics, and then they wouldn't give me more. So I had to fight pretty hard to continue getting what I felt I needed, which for me has always been antibiotics. I know everybody's different with that. I ended up not having to leave my job as a teacher, really bummed. And I know that's something a lot of people deal with is career changes, not being able to do what they used to be able to do. And it was heartbreaking for me. It affected my social life. It affected everything. I found some things that helped me along the way. One of them was the heat. I found that saunas really helped at the beginning of all this. And again, another really lucky thing that the heat really always helped me. Sweating it out always really helped me. I ended up being able to do hot yoga, which again, I'm grateful I was able to do. And I still suffered a lot, but I was able to maintain somewhat functioning level. And I actually, because I got laid off and I didn't finish my master's degree on time to continue getting another teacher job, I actually went to Abu Dhabi and started teaching there. So that was my other journey. And my whole reasoning for going there was because they gave me a job that paid decently, but also I figured out that I could get antibiotics pretty easily over there when I couldn't here. So I stayed there for a little while. And when I was over there, I ended up kind of coming to an epiphany that I really just couldn't teach anymore, period. Which just wasn't something I was able to do. And I also realized that I wasn't really even passionate about teaching anymore. I really realized I was passionate about mental health. I had students that had been refugees that had mental health issues. I was also really passionate about art therapy, which is something I always wanted to do and was too chicken to do it. So I kind of used my failing health and this kind of like, what next? What can I possibly do next? And I applied to Lesley University in Cambridge to their art therapy and mental health program. And I knew I couldn't do full time there. So I went part-time and I continued to kind of do different treatments along the way. Also continued to suffer a lot when I was there, trying to balance even part-time classes with trying to have a job and trying to also remain somewhat social was a huge, huge challenge. And so my first year that I was there, I actually decided to support my brother, who was running the Boston Marathon. And I went to the day that he ran the marathon in 2013, and my mother and I were there at the finish line. It was really hard to get out of bed that day. It was hard for me to even walk. And I remember being really emotional just watching these runners complete the marathon and seeing the support they had, and me being like, I wish someone could cheer for me that way just for getting out of bed, because it feels like I was exhausted as some of these runners. And as I was having thoughts like that, again, another trigger, that this might be hard for some people if you've had some trauma, but my mother and I were in the midst of the two bombs in between both of them when they went off. And all I remember in those moments is like, I feeling like I'm done for, like I am screwed, like I already am so sick. And going through this amount of trauma, like how am I ever going to regain my health? Because up until that point, all I had heard was how much stress and trauma affect the body. That was kind of my healing journey. I have to stay stress free. I have to remain, calm and relaxed. And like having something like that happen after learning that information was like, oh God, like how am I ever going to come back from this? And so, those months after that, those weeks, I barely left my house. I was extremely depressed. I had survivor's guilt. Also really felt really sick and in tremendous pain. And was just questioning, like, why wasn't I one of the injured ones? Like why did this happen to me? And why do I have such a hard time walking? And why didn't I lose my leg? When all these other people are lost limbs and I feel sick and I can barely even walk. It hurts to walk, and so I really, really struggled a lot with all these mixed emotions and feeling like I had this invisible illness. And I think one of the other major challenges for me was seeing all the support for all the survivors, which sounds like a terrible thing. Obviously, these survivors deserve support and as much resources and access to whatever they needed. For me, it just made me feel more invisible because I wasn't injured. And again, it was like I was now suffering from two invisible illnesses. And I felt really guilty for having any kind of like thoughts on that too. And so it was just, I was like a really broken spirit. And I think a lot of us get to that place sometimes. In the midst of this, though, one of my professors took me aside after class one day because she knew I was really struggling. And she taught me about this thing called post-traumatic growth. Raise your hand if any of you guys have heard of post-traumatic growth. Okay, I see a couple hands. All right, cool. So my pet peeve is that today, when trauma happens, we hear all about PTSD. And in fact, it's actually not as common as we might think. There's a lot of people that don't have PTSD after trauma. But there's also a segment of the population after trauma that go on to experience something called PTG, post-traumatic growth. And a lot of the times, those people are the ones that have a really difficult time initially. They're the more sensitive spirits. They're the people that, have empathy or have more feelings, and they have a really hard time initially. And there's what Stanford University is the school that spent a lot of time studying what factors lead to this concept of post-traumatic growth and how it presents in people. And when I think of post-traumatic growth and I'm describing it to people, I often think of people like on the news that are sharing books that they've read to help other people, how they made sense of a really horrific experience and are now, starting nonprofits. Shout out to Maria. Maybe you've experienced post-traumatic growth, but people that, they're not necessarily grateful for their trauma. They're not necessarily grateful for their illness, but they can look at things and say, I'm a changed person because of this. I'm a better person because of this. I have richer relationships because of this experience. And I'm just, more spiritual, and I'm more grateful for every day after all of this. And so that's kind of how it presents. And the factors, because of course I became like a little bookworm reading about post-traumatic growth, because I was like, I can't carry this trauma and be in this fight or flight mode forever. Like, how do I get to this point of healing from this trauma? And that, I could go on and on about too. But what I will share is what the factors involved with people that experience post-traumatic growth. Community is a huge one. Having people that have lived through the similar experiences as you. Gratitude is another one. Finding gratitude in little things and everyday things. So there is a little bit of mindset to it, but also spirituality. And that doesn't mean you have to be like religious and going to church. It doesn't really matter what spirituality it is. It's just having some kind of faith in something bigger than us. And also, one of the other factors is meaning and purpose. So being able to kind of take your trauma and make a story out of it. Like, why did this happen to me? I believe this happened to me because of this, or now I have this purpose. Now I'm going to help others that have gone through this. So I learned all about post-traumatic growth. And again, I also looked at my experience with Lyme and was like, it makes sense that people like me suffer so much emotionally, because we're so isolated. Like, there's not really community in this in people suffering from chronic illness. You're isolated. And then I looked at the people, all these displays, these beautiful displays in Boston after the marathon, like the shoes that were the little, the shapes of the hearts, a lot of the support groups, a lot of the, even just like people singing out windows and, that we had in the pandemic too, like that all is so healing for us. And I realized, I'm like, we don't have any of that. Like, I'd never really gone to a support group for Lyme. That kind of started a couple of years later, but I decided that how I needed to heal from my trauma of the marathon and how I needed to heal myself was that I needed to create a community for people with Lyme disease. And I needed to help people like myself that felt isolated, that felt alone, lost, not supported, not seen. And so for the next 2 years in grad school, that was what kept me going. That every time I felt like so sick and I had to have, disability services at school, so I could sometimes rest instead of going to class or turn in papers late if I needed to. But every time I felt like giving up or really discouraged with how my treatment was progressing, I said, I have to keep going because this is my mission. Little side note, a lot of people that actually beat the odds at cancer treatment or any other health issues where they kind of go beyond the prognosis and live longer or are cured when there's not a lot of hope for that, they are people that they're more likely to have meaning and purpose in their life. So they have a mission. And so none of you have a mission today, start to think about that. It's really important. And it doesn't have to be about Lyme. It doesn't have to be about illness. It can be something else. Some people have children as their mission. Some people have their dog or their cats. Something simple, but it can also be something big. And for me, it did need to be big. So anyway, yeah, I remember telling my mom when I was in grad school, she's like, what are you going to do when you graduate? There's not a lot of jobs for art therapists out there. What's your plan? And I remember saying, oh, I'm going to work at a holistic center for Lyme disease and I'm going to start support groups and I'm going to do one-on-one counseling. And she's like, but there's no clinics like that, right? And I was like, no, but I had it, like, talking about manifesting or whatever it was, which I know is sometimes not, manifesting isn't always like, it's kind of a term of privilege sometimes. But for me, I was like, no, this is what I'm going to do. This is my vision. I'm going to find a way to do this. Sure enough, I wrote my thesis on hot yoga and Lyme disease and my own story with that. And I posted it on Facebook, and this woman named Nevena Zubjevic reached out to me and said, hey, saw your paper. We're going to be starting a clinic at Spalding Rehab for Lyme disease. I'd love to talk with you. And I was like, whoa, I'd love to talk with you. I think she initially wanted to hire me for research. And I was like, no, like, I don't want to do research. I want to do mental health counseling. You guys need a mental health counselor if you're a clinic treating Lyme. You can't just treat, with rehab and whatever else your plans are for the medical stuff. You have to have a mental health counselor. We need a support group. And she, so there was no plan in place at the time. And I met Brandy Dean, the founder of the clinic, and she was like, absolutely, we need a mental health counselor. So again, like another little lesson is like, if you feel like there's no place for what you want to do, you can create it. With passion, sometimes these things manifest. And so I got hired at the Dean Center. Just another kind of like little spiritual coincidence was the Dean Center opened its doors 2 weeks after I graduated grad school. And it also, as you know, was part of Spalding Rehabilitation Hospital. But the freaky thing about all that, my whole journey with all of this, is that Spalding Rehab opened its doors in 2013, the new hospital, and they are renowned for treating all the marathon victims and survivors. So it's just another like odd coincidence that I was there at this hospital every day that is famous for treating Boston Marathon survivors. And so it just made a little more sense to my whole experience. So I worked for the Dean Center starting in 2015 up until 2022. I worked there. I did support groups. I did wellness groups, one-on-one counseling. I did public speaking events for them. Started an outpatient Reiki program, and I was still sick a lot of the time. My trajectory of getting better was very slow. And what else? I ended up starting a fundraiser to go to Germany in 2019, which was really, really difficult for me. At that point, I had found that heat helped me so much, and I found a place to do hyperthermia treatment. And I don't think that treatment is for everybody. A lot of people have so many questions about it. The reason I'm sharing that part with you today is not because I want to talk about hyperthermia or why everyone should do it or that it's going to be a cure for everyone. Even though it helped me, I truly believe that it helped me kind of get to this place with my health because I had to like put myself on the line and really ask for help. And that was something that through all these years, I was single, I was living alone. Like I really never asked anybody for help. I tried to help other people. And I do think for people with chronic illness, sometimes there are these like spiritual hurdles we need to get over. Sometimes it's leaving a toxic relationship. Sometimes it's leaving a toxic job, but sometimes it's also just asking for help and telling people we need help. And I think for me, there was a huge component of that in my journey of getting significantly better. I came back from Germany and got pregnant with my daughter, who's now 3. No health issues. She's great. I'm great. I started my own practice, Kerry LMHC, 2 years ago. At Spalding, before I left, I also started working with COVID long haulers too. And I'd love to answer some questions about, some of the parallels I've seen with these different populations. In my own private practice, I see patients one-on-one. I also run support groups from the Massachusetts MECFS Association. And what else? I think I have some notes. Let me see if I'm missing anything. Yeah, so I'm happy to take questions. Before I do that, I also just want to share some future stuff too. And I have other notes that I can get into as well. Stuff I want to share with you all if we have time. One of the things I wanted to share is that my missions now and in the future, if you all want to stay in touch with me, I'm happy to share some information. Right now, what I really am working towards with my friend Sarah, who attended Germany with me, the same treatment, was successful for her as well. We're both licensed mental health counselors, and we are now working on starting trainings for other mental health providers on Lyme disease, long COVID, MECFS, and another training I'm in the midst of that I'm going to be offering in the future on top of everything else I'm doing is ketamine assisted psychotherapy. So I am not an expert in that. I'm still in the midst of like getting trained. But I'm happy to talk about that too, because that is something that's fairly new. And I do think it can be pretty helpful for a lot of people in this population. And it's really also great for trauma. So there we go. That was a lot. I'm sorry. I just did so much talking. It wasn't too rambly.
It was very important to hear your story. I think it will spark some questions,
Yeah.
and
Thank you.
please let us know either by raising your virtual hand or your hand, and you can also type in the chat if you have questions. Who'd like to go first? Kerry, can you tell us a little bit more about transitioning into private practice? Was it a big shock for you? Was it a good transition?
Mm-hmm. Yeah, I think what's so tricky about mental health counselors is that I'm very much like a creative person. And so the business side of things is like it's not really like my kind of brain, but I've found some support systems and just systems in general that have really helped me with that business side piece. It's still a work in progress because I again I still have to take care of myself. Like I consider myself in remission, but I don't have as much energy as I would like to have. All my energy does go to my 3-year-old. So and then one-on-one appointments. Like I wish I had this beautiful website. There's so many things I still want to do on the business side of things. But yeah, it's been really nice. And I do often say that for a lot of people with chronic illness, like a lot of us do have to make a pivot with our careers. And if you can, I mean, it's a double-edged sword because if you can find a job where you can set your own hours and work for yourself, that's great. The other side of the coin is if you're not married, you have to figure out health insurance, which has been not so fun for me. But just the time management piece and freedom is great for me in my current situation right now. Yeah. Thanks for asking.
And what are some of the upcoming workshops you have for clients?
Yeah, I will tell you, I was doing a lot of art therapy workshops and a lot of art therapy groups, and I love doing that. I still love to do it and want to get back to it someday. But I ended up kind of coming to this epiphany several months back that I really wanted to work on these trainings. And so that is unfortunately taking a little bit of a backseat right now. It's quite intensive to kind of develop all the trainings and getting like the CEs approved and all of that, and then the promotion. So that's where my focus is right now. But I still do bi-monthly groups with the Mass MECFS Association. And they're announced there. And we do it's for young adults. And again, it's like also Lyme, long COVID, MECFS. But yeah, I can, if you want to be added to my email list, I can certainly share a link to add yourself so that I can let everyone know when my upcoming groups are when I get back to that.
And some of our clients are from out of state. Can you explain your service area for yourself?
Yeah. So actually I'm glad you mentioned that because I am only licensed in Massachusetts, and right now I've just got licensed in Colorado, which is kind of a random state. It's not a New England state, but if any of you are located in Colorado and want therapy, you can certainly reach out to me. It's a bummer because like I wish that licensure was easier to kind of transfer to other states, and other states are coming up with this pact where if you're like licensed in one state, you can see clients in another, but Massachusetts is not part of that pact, unfortunately. So they seem to be the most regimented state in terms of like licensures for certain careers, and it is what it is. But yeah, Colorado and Massachusetts, and just so you know, the kind of rules are so it doesn't actually matter. I actually see some clients whose like residence is technically in Rhode Island, but they attend college in Massachusetts. As long as you're physically present in the state of Massachusetts, it's at the time of our session, that's what matters. So, if you live on the border of Rhode Island or New Hampshire and can go to a friend's house in Massachusetts and you want to see me, we can make it work. So that's just another helpful little piece of information. You just hear.
We have a question in the chat.
Yes.
From Lisa. She says, thank you for sharing your story. Could you share some of the main mental health issues and not sure what the
Symptoms?
symptoms that those with long COVID, strep, and Lyme experience that you found?
Yeah. So I think I know what you're referring to in terms of strep, because that can also cause a lot of mental, issues as well. I think of PANS and PANDAS, which is, mostly in pediatric population, but can also be in adults as well. I don't typically work with the PANS or PANDAS population, although I do know that a lot of the times, actually I used to do in-home behavioral therapy, and a lot of the times that does present as school refusal, and attachment issues with the parent, not wanting to leave the parent, and also OCD-like behaviors with strep. I know that tends to be more common. With long COVID and Lyme, it's really interesting because I definitely think those issues kind of overlap. And I know there's even some speculation that COVID could kind of wake up like Lyme and somebody who might have like dormant Lyme. I think we're seeing that happen and we just haven't caught on to it yet. At the beginning of the pandemic, there was definitely some trauma mixed with symptoms of long COVID, like anxiety, that might be more physiological, but we also had a lot of people that I worked with initially that had been intubated, and it was really, really scary, and their families couldn't visit them. So that's very much unique to COVID, obviously. We don't have Lyme patients that have been intubated with, all the lung stuff. We don't typically see that. But I will say in both populations, POTS, post-orthostatic tachycardia syndrome, is very prevalent. And I think with that, we're seeing a little bit, of anxiety. And I think sometimes what I always say is sometimes, like, obviously your heart racing, like your brain tries to match your body. So if your heart is racing a mile a minute, your brain's going to say, oh, geez, like my heart's racing, something must be wrong. I must be running from a giant bear, or predator. And so our brains try to match up with what's going on in our body. And so I think for a lot of people that presents as anxiety, and then, you go to the doctor and you say your heart's racing and you're anxious and they don't diagnose you. So then you're left with like the gaslighting and the medical trauma. Very similar in both populations. And I think just a lot of, I don't know if we definitely see depression, but I also just see people that want to be more active and they just are stuck in bed. And so I don't know if that's always depression. I think sometimes there's a little bit of a gray area with that. I definitely think anxiety is a big, big piece. And also, losing so much over time can naturally lead to depression as well. But one of the things that I found interesting at a talk, I forget which lecture it was with the Massachusetts MECFS Association, was somebody was actually, a doctor was asked a question about what's the difference between depression and Lyme, and how do you answer that? Like, how do you know if people are just depressed or if they're just, extremely fatigued? Myself, I could answer all these questions on a depression survey years ago, and I would have come out depressed. But if you asked me, I would say I'm not depressed. I just want to get better. And so I think I really love this answer because it helps me a lot in kind of assessing patients. When you ask a severely depressed person what they would want to do when they got better, they would say, I can't think of anything. I don't want to do anything, because that's depression, right? It's not really wanting to do anything. If you are to ask a person with Lyme what they want to do, and they don't have serious depression or severe depression, you ask a person with Lyme who's stuck in bed, sick, what they want to do when they get better, the list could be a mile long. And so I really liked and appreciated hearing that, because I think that really speaks volumes, because it's so misunderstood and often misperceived as just depression, when for a lot of us, it's not. It's being sick.
I know I have a huge list. Skiing, horseback riding,
Yeah.
having a regular schedule,
Yeah.
and not being slave to symptoms.
Right, right. And it's so heartbreaking when we hear, which I heard too from people, like, oh, you just gotta, you just gotta get out of bed. You just gotta force yourself. And it's like, no, like I wish I could. I can't. I will suffer more. Um, yeah, and I know that's a huge thing for so many people. And I also think what's made me so passionate about wanting to train other providers is that sometimes even mental health counselors can say harmful things or assume it's depression and say, you just got to force yourself to go for a walk. And it's like, no, like with long COVID too, it's really harmful advice to tell people to force themselves to do things that will lead to post-exertional malaise. So that's another reason, like I've just become so passionate, because it makes me so sad to hear people say, like, I went to a mental health counselor and they just made it worse, and I don't want to see another mental health counselor again because you guys don't help me. I want this field to be able to help people and also identify symptoms in people so they can tell their patients, you should get tested for Lyme.
What recommendations do you have for people who, and I think we all to a certain level have experienced this, medical trauma, gaslighting?
Yeah, that's a tough one. And I think for everybody it's different. I was stuck in my anger for a long time. I do think having an outlet for that can really be helpful. And again, sometimes that can be part of your purpose too, like educating others, sharing your story. Sometimes I'll tell people, sometimes I won't tell people, but sometimes for some patients, it might feel empowering to share some research from Johns Hopkins or one of the major universities that's actually proving what's happening. For some people, I think that might feel good. For others, it's too much. It's too much energy, and it still might not make them feel good, and they still might not get the response they want. But that is where I do feel like seeing a mental health provider that can be helpful is a really good idea, because they can help you process some of the trauma, because medical trauma is real. And that is an area I will share I still deal with. I still, in the age of COVID and my daughter attending a preschool and germs and, tick bites that I can't always prevent, it comes up a lot. And I think trauma, there's many options out there for trauma therapy. And I think, finding an approach that's right for you is important.
We have some questions coming in.
Yeah,
Um,
sure.
from Lisa M. My adult daughter is in denial regarding her Lyme diagnosis. Have you ever dealt with any clients who have this? She's quite sick and I feel so helpless.
Yeah. That's really tough. Yeah, I feel like I have family members that also, and it's so hard when it's your child, because it's a little bit different, and it's a lot harder to simply just, brush off and say it's not my problem. I do also really think though that just being a support is important, and kind of holding space for somebody in whatever stage of the journey they're on is important. Um, because at the end of the day, your daughter needs support, and to know she has somebody to listen to her. And the last thing you want to do is push someone away because you think you know what what the answer is. Your daughter, I don't know. It's so hard, right? Because like we think we know, we have our own journeys that we heal from, and as a mental health counselor, I deal with it every day where I see patients and I want to tell them go get tested for Lyme, and I might plant the seed, but I know that it's not my job, first of all, and that's again a little bit different where a loved one comes in, but at the end of the day, like your daughter may find something else that's helpful, and it may still be Lyme that she's suffering from. It probably is, but it also may be that she finds something else to help that isn't necessarily what you envision for her. And I think just supporting her and whatever her thoughts are. But yeah, I'm happy to talk one-on-one with anybody who wants any kind of more specific advice too, without knowing more about the situation. But I think getting a mental health counselor is important for anybody.
Barbara F has a question. Home care CNA and the confusion in organization is a real problem. Suggestions, as very few mental health practitioners here in Southeast Pennsylvania. And she's even tried the ILADS.
Yeah. Confusion in organization. Oh, so okay. Confusion in organization for your job. Yeah, that's tough. There is a really great Pennsylvania support group that's separate from ILADS. It's a pretty decent sized organization, Maria. You probably know about it.
Yeah, I think I've sent that information out.
Okay, yeah, that might be helpful. It's a tough thing. Like I know I mentioned my own journey with like ADHD and medication. I don't, I'm not a prescriber and I don't say I recommend them, but for some people seeing, I always say like, it's so important to get to the bottom of our issues, but sometimes band-aids have their place too. And if, you're not able to work and then you lose health insurance, and then you can't get any treatment, then that's a problem too. So sometimes going to see a psychiatrist for something that can be helpful can be a good idea, it's just a thought. I know for me, I had to work to maintain health insurance and I needed some support to do that for my ADHD symptoms, which are probably Lyme, but at the end of the day, the stuff helped me get me through.
I just looked up the Pennsylvania group.
Yeah.
Anyone else? More questions?
Kerry, I'd love to hear a little bit more about how you incorporate art therapy into working with clients.
Yeah, I'd love to share that. I have done a lot of group work with art therapy and I really love doing that. And it's not every single patient I see that we do art therapy with, but there's just a lot of really great like mind body exercises you can do. For myself early on, I kind of noticed that like I knew that meditation was really valuable and really important and a really great thing. It's only been, in the years since I was diagnosed with Lyme, even more proven how much how many health benefits we can get from meditation, right? But I've always been one of those people that like I can't sit still. And and if I had joint pain or muscle pain, like sitting still and trying to meditate, I'd either fall asleep or the pain would just get louder. So one of the ways that I really think art therapy can be tremendously valuable is kind of just serving as like an anchor for being able to move and have something to kind of focus on and allowing yourself to achieve a meditative state. And that obviously, whatever art you're doing, you're only achieving a meditative state if your brain's, not caught up in thought. So obviously like self-portraits or something that requires a lot of like analytical thinking isn't going to get you in that state. But there are adult coloring books, which isn't really art therapy, but even crocheting, something that can be repetitive. I love mandalas. There's something called, I'll type it in the chat, tangle doodling, Zen doodling. There's lots of like really cool activities like that that can be repetitive, fun, simple, that can just get your brain to kind of tune off. And there's another state of the brain called the flow state, which is different from meditation. Flow has also been shown to be super valuable. When you're in a state of flow, you kind of lose concept of time. It's kind of like what a lot of artists are known for, like losing track of time, getting obsessed with a painting, kind of like tuning out everything else. That's a flow state. And flow state's really great because oftentimes when we're in a flow state, we don't pay attention to our pain. We don't pay attention to our stress. So anytime we're caught up in something that we're passionate about, that we're just hyper focused on is a good thing. And so for a lot of my individual patients, I try to really pick their brain and get to know them and get to kind of brainstorm together. What is something that could get you in a flow state, especially if you're not working, if you're not able to do a whole lot of other things, is there something we can find, like playing the guitar, for example? Music can also do that for us. In terms of mind body medicine, there's also a lot of really great exercises. I really can't stand the pain scale of like, what's your pain from 1 to 10, especially when you have multiple symptoms. One of the things that I also do is I like to get like the outline of the body. You can just Google like body outline and find one that works for you that you relate to. And you can, I try to do like a guided meditation of just a body scan, but imagining what colors might represent different sensations in your body. At one point, I remember I had extreme shoulder neck pain, which I'm sure a lot of you deal with. And I used to be really frustrated when I tell people I have shoulder pain, and like, of course, it's like, well, that's what you get when you're stressed. And like, no, like you don't understand how bad this is. This is not just like stress, muscle pain. And when I did this exercise the first time, I literally drew fire on my shoulders and neck, because that's what it felt like. And it felt really healing for me to be able to give that like an image. And so this whole exercise of like drawing the energy around your body can be really helpful, because a lot of the times pain and what our physical sensations are, there's just not really words, brain fog. I like the idea of fog. What might you depict brain fog as looking like if you were to, create a picture of it? And things like that can be really helpful and kind of validating, like, a lot of the times people will show family members or loved ones the images they create with me. And that loved one might say, wow, like I had no idea when you said you were tired, but that's what your experience is. And it's just more powerful, to relay a lived experience like that. Those are just some things. Yeah.
Sorry, I needed to unmute. Marcy has a question.
Sure.
She's curious about if you were a certified art therapist, but also she says she's an occupational therapist and she worked closely with art therapists, solely with mental health patients. So she's
Yeah.
intrigued to know what kind of training is out there right now to work with folks who are chronic.
Marcy, what state are you in?
She's Massachusetts.
Oh, Massachusetts. Okay. Yeah. So, the kind of like certifications and stuff and legal permissions or whatever with art therapists vary from state to state. That's why I asked that question. So I got all the training as an art therapist and graduated from an art therapy program from Leslie, master's degree. Great, fantastic program, one of the best in the world for art therapy. To be honest with you, I could get the letters after my name if I wanted to pursue that. And I should maybe at some point. I found that because I'm a licensed mental health counselor and I have the training as an art therapist, it just hasn't been necessary for me to spend that money and doing, like, I think you have to do a little bit of supervision, but I've already had, you know, insurances don't reimburse in Massachusetts, at least, art therapy alone. But they'll reimburse for mental health counseling, even if it's the approach of art therapy, if that makes sense. So I don't know, hopefully that kind of clarifies why I haven't really dealt with like getting the exact certification of an art therapist. I do feel like I'm highly qualified as an art therapist. I'm not someone just like posing as one. You know, yeah, it's hopefully that explains it.
Well, no, Maria cut off part of the last question. I don't,
Oh, okay.
it's just, I was asking if you actually had training with working with people with chronic fatiguing or disabling diseases. That's actually kind of a key part of the question.
Yeah. Okay. Yeah. So, I know when I was in grad school, I did have to have 2 internships, and I remember being so frustrated trying to like reach out to all the hospitals because I really wanted to work with people and patients in hospitals, and like for some reason it was really hard to get a position like that. But I did work for a place called Bay Cove, which people have all kinds of intellectual disabilities and physical disabilities, as my internship, which sort of guided, you know, the kind of program I created at the Dean Center, which was a lot of art therapy, working with people that had Lyme disease and then long COVID. I hope that explains a little bit more.
Thank you.
Yeah. There is a woman named Kathy Melchiotti. I'll write her name in the bar. She's like my, I don't know what I would call her, but she's great. She's like one of like the, not the founders, but she's like one of the top leaders in the world, I think, for art therapy. And she's written some wonderful books. So I've often turned to her literature and her research on art therapy, where she's written a book, I think, art therapy in healthcare settings, which is really great. Yeah. For what it's worth too, I should probably also clarify, sometimes I'm guilty of saying I'm just an art therapist, but I actually am trained as an expressive art therapist, which if you're looking for an art therapist or an expressive art therapist, it might be important to know the difference. Expressive art therapy actually encompasses more than art therapy. It also encompasses music therapy, drama therapy, narrative therapy, all the creative arts, whereas art therapy is just visual arts. So I don't know if that kind of resonates with any of you, but it is probably a distinction I should make.
Anyone else? Questions, concerns?
Just
No?
curious if maybe you want to talk a little bit about working with people around grief with the loss.
Good
Mhm.
question.
Yeah, yeah. Are you talking about in terms of chronic illness or just
Yeah,
in,
the like
yeah.
losses around chronic illness.
Yeah. Gosh, I feel like I need to sit with that for a minute and just think of all the different ways. I think I sometimes honestly struggle even with my clients, and I'll be open with them just about like at what point do you accept, you know, that this is permanent, or accept that this is your illness versus, and I think that this was so challenging about this compared to other losses or other disabling conditions, is that for some people, they just are on this continuous journey trying every treatment, and I don't feel like it's right to tell them to stop, but I think first and foremost is when you decide that it's time to accept your diagnosis or whatever prognosis this is. But I do think that finding community is huge, and finding others that are living a similar experience. It doesn't have to be the same illness. One analogy I've been making lately for some reason with people is like, I think I was like watching the Kardashians or something really dumb on TV the other day. And I was just thinking to myself, like, wow, these people are so filthy rich. And just thinking like, if I, making whatever income I make right now, surround myself with people like the Kardashians that are multimillionaires that have chefs and all these things, like I'm going to be sitting there and thinking of all these things that I don't have, that I should have, that I want, brand name bags, blah, 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 you name it. And, but if I surround myself with people that are suffering, or some of my patients, for example, that are extremely financially hardshipped, like I'm not somebody who feels bad for myself very often, because I hear of really difficult situations. And so I think for a lot of people, it's important to surround yourself with people who get it, to some degree. Because like, again, if you surround yourself, like I did sometimes in my 20s, like I felt so isolated. All my friends were getting married, buying houses. I couldn't do any of that. And it was extremely difficult until I found my tribe, if you will. So I do think community is huge. And I think there are a lot of really powerful tools in art therapy, and also finding some type of spirituality and meaning.
And I think people need to remember that even if you have all the money in the world and can try all the different therapies, it doesn't mean you're going to get better.
Yeah. Yeah.
That sometimes it's the simple things, the least expensive things, and like you said, focusing on other pieces of your life that you can change, like your perspective, like your spirituality.
I really like the idea of like a 12-step program for chronic illness. Like if I ever have enough time, I'll like really hone in on like the 12 steps for AA, because I think there's so much value in that. And again, like for people with addiction challenges, like, the whole premise of AA is being part of a community and going through these steps to evolve and develop this whole other side of yourself. And I really like that idea for chronic illness, in terms of like accepting, but also kind of working on some of these other pieces of yourself to kind of even go through the grieving process of it too. Although the one thing I wouldn't do, the one step I wouldn't have in chronic illness is like, I don't think anybody needs to apologize. I know at the 12 steps, it's like, there's a big piece of like apologizing for things, for letting people down in your addiction or whatever. And I just, that part, we already feel guilty enough, most of us. So like, we can make that something else.
Well, in the concept of being powerless too,
Yeah,
because you can be empowered to change how you look at things.
exactly. Yeah. Yeah. And I do think like, forgiveness, because again, like I'm one of those people that I was caught up in people that I thought didn't treat me well. And I let bitterness and anger like eat me up for a long time. And I think that's also really important to work through as well. Yeah. And I think with that is also accepting that others don't get it, no matter how hard you try to make them get it. That's a really hard thing.
Do you have any advice for people with being triggered? Any useful tips to help with that feeling?
Triggered in terms of like, like medical stuff, or I actually just think being aware. I mean, that's so simple, but like just being aware of your triggers and being able to name them and name the emotions they bring up can be huge. And being able to talk with a friend about it, because it kind of takes away from like being engrossed in it when you're able to say, oh, like I'm reacting this way because this reminds me of this, versus just remaining caught up in it, you know. I'm trying to think of others. There are also other approaches to therapy that I'm not trained in. EMDR can be really great for certain types of trauma. There's another approach called brain spotting, which can also be really helpful for if you feel like you have like the symptoms of PTSD, like can't even step foot in a hospital kind of thing, or it becomes a little more limiting in your life. I think those types of approaches, having like that trauma addressed is huge. And I do some trauma treatment, but it's really important to have more specialized treatment if that's what you need to. If it's limiting you from being able to get better, absolutely, it's so important.
Well, even the trigger of, oh, I'm afraid to go outside because there's ticks in my grass, or I think I made a post this morning that came from Tick Report saying, don't be afraid of your Christmas tree. And there's been circulating, oh, you've got to spray your Christmas tree with permethrin and it's full of ticks, and people are panicking.
Yeah.
So trying to reduce that trauma when you see a news article about Lyme disease or the ticks being active. Some helpful advice there for not getting caught up in, I don't know, I hate to say hysteria, but trauma.
Well, what I always say to people too, like, sometimes anxiety can serve a purpose and sometimes it doesn't. And I think you really have to determine, like, is my anxiety serving a purpose right now or is it not? For example, like when I go out into the woods and I'm a little bit nervous, just a little bit nervous, I'm more cautious of ticks. I take all that nervousness or that anxiety causes me to take all the steps I should take to prevent a tick bite, right? That's helpful anxiety. Like we have anxiety to help us survive. It's a natural thing. The problem is that when anxiety paralyzes us and makes us, not leave our homes, like if we can at least leave our homes like that, that's when it impacts our health negatively. And so I always try to ask myself, and I tell my patients, ask yourself, is it serving a purpose? And if it's not, that's when you got to do the breathing exercises or whatever stress relieving exercises you found helpful for you. There's that Irish blessing or whatever that, like, I forget what it is. It's like, God grant me permission to accept what I can't control. And try, I forget, but it's kind of like along those lines if you're Irish and have heard of that whole phrase. I like that idea of like really, because I do say, like, for some people we are so caught up in this modern, mental health jargon that we tend to sometimes think that any amount of anxiety is a bad thing. And I don't really think that's true. Like, I really hate how so many people are made to feel like they're overly anxious for wearing masks these days, because I think a lot of us should be, if not all of us, in public settings, especially this time of year. And it's like, okay, well, to other people that might be anxiety, but to people that know the science and have certain vulnerabilities, that's them protecting themselves. So even if that is anxiety, it's probably a good thing,
And this is why we're virtual and not in the office.
Yeah, exactly. Yeah.
An abundance of caution.
Right. But like, I mean, but there are other times, like, I mean, I realized that my isolation last year was affecting me really negatively, and I started socializing more. I think everybody's different with that. Because we also know that, like, not going outside and not doing, like, letting your anxiety keep you from doing other things that are good for your health is really not a good thing either. So I think everybody's different with what decisions they have to make. And again, that's another good reason to see a therapist, because you can really nail down what steps you need to take and what's right for you, you know?
Barbara has something to say. She said, my daughter and I own a hobby farm of birds and have to be outside all the time.
Yeah.
We do have a lot of woods with deer surrounding. So we just concentrate on our faith to overcome our thoughts.
Yeah. And also, like, have a plan. If you get a tick bite, what are you going to do? Like, I made sure from day one that my daughter and I have a doctor that will treat with antibiotics if we get a tick bite, and that I know where to send the tick out, and, you know, for testing. And so it is always good, if your anxiety is getting the best of you, lay out a plan for what you can do if you do get bit, or, you know, X, Y, or if you do get COVID, you know, what's your plan, so that you know.
Well, in prevention is great. You put on suntan lotion so you don't get a sunburn.
Yeah.
Take prevention steps to keep from being bitten in the first place.
Exactly. That's huge. But even, I mean, at the end of the day, like, it could still happen, and we know that. So, like, if it does, which if you live where I live, it has happened, like, you also have a plan, you know, in the same way that COVID might be avoidable for some of us.
Do you have any final ideas or thoughts about helping the group just kind of relax and wind down towards the end of this group?
I just know it is a very busy time of year and there's a lot of stress, myself included, feeling stressed out, that comes with this time of year, as well as pressure and difficult feelings and lack of vitamin D. So I like to just remind people to just breathe. And one of the exercises that I like to do is just, you know, putting my hand on my heart, just close your eyes. And if you can just imagine a healing light, and imagine that light being your favorite color, I want you to really visualize it. And inhale that light through your nose. And as you're inhaling, I want you to visualize that light just traveling throughout your body and really going to all the spots that need some nurturing, some relief or release. And as you exhale, just imagine all the stress and all the gunk and all the toxins that you might need to release exiting through that mouth. For me, I picture a black smoke with dust coming out. And again, inhale. And exhale again. And if you feel inspired after this, I would invite you to get some markers or colored pencils, oil pastels, and draw your breath. Draw what you just envisioned. You can do that exercise anytime. I don't know on my website if the sign up for my email list is there. Maria, is that okay if I share that, just so that people can stay in touch if they want to?
Nellie has shared your website
Awesome, thank you.
and
Wonderful.
your email.
Awesome. Great. It was so nice chatting with you all today. Thank you for listening to me and my story.
Thank you so much for sharing.
Yeah. Remember, there's healing in making your story too, and writing it down if you have the energy, or even just telling it to someone else.
Thank you so much, Kerry.
Thank